Perfect. I'd like to go ahead and get started. My name is Melissa Ruggiero, and I have been in contact with most of you as your admissions counselor. I'd like to thank you for joining me this evening for our monthly Doctor of Pharmacy virtual information session. The session should last about 40 to 45 minutes. If you do have questions, do feel free to utilize the chat function. I will address those questions as they come up. If I don't get to your questions at that time, I will make sure to leave time towards the end of the session to answer all questions. So do just type those into the chat function, and then I will address those verbally. So we will go ahead and get started. I just want to make sure everyone can see my screen. Are you all able to see my screen? And I may have want to make sure that's still there for you, and if not, I can go ahead and reshare it. Great, perfect. So here you will see an overview of everything that we will be reviewing today. We're going to start off by providing a quick overview of Regis University as a whole. I'll then talk a little bit more about the career of pharmacy. Following that, I'm going to talk about the curriculum at Regis University and our Doctor of Pharmacy program, what makes us unique from so many other pharmacy programs out there. And then I'll talk about the Regis community, what's available to all of our students. And then we'll conclude the session talking about your commitment and next steps really catered to those of you who are ready to start the application process and those of you who may have already entered that application process. So a little bit about Regis University. Regis was founded in 1877. We are located in Denver, Colorado, and we are a private nonprofit Jesuit institution. What it really means in being a Jesuit school is we are exemplifying the 500-year-old tradition of academic rigor, intellectual exchange, and faculty commitment to each individual student and our alumni's personal development. And being a Jesuit school, we are a division of the Catholic faith. That being said, about 55% of the Regis community comes from faiths outside of the Catholic Church. We are accepting and welcoming of all walks of life. The biggest thing in being a Jesuit school is the mission that coincides with the Jesuits, which is men and women in service of others. We put a lot of focus in giving back to the community and helping our students develop those empathetic and moral thinking traits to be able to treat individuals different from their own and really develop it into stronger individuals. Other Jesuit institutions include Georgetown, Boston College, Creighton, Xavier, and the four Loyola universities, among others. We are one of 28 Jesuit schools and one of two schools of pharmacies that are Jesuit, the other one being Creighton University in Nebraska. Regis University has been ranked as the top university in the West for a consecutive 20 years by U.S. News and World Report, something that we are very proud of. I want to talk a little bit more about Regis University as a whole. So Regis University is made up of 5 separate colleges. I am here this evening to represent Rickard Hartman, our College of Health Professionals. Within that college, we have our School of Pharmacy, we have our School of Physical Therapy, we have an occupational therapy program, we have our division of counseling, and we have our health services education division as well as a number of nursing programs. So those are all of our healthcare related programs, most of those being taught on campus, some of those in an online format. In addition to Rickard Hartman, we have Regis College, which is our traditional undergraduate college population, made up of about 2,000 students. Those are our students coming directly out of high school. Most of them live on campus, take classes during the day, and are working towards an undergraduate degree. And then we have our College of Contemporary and Liberal Studies, our College of Business and Economics, and our College of Computer and Information Sciences. Those are 3 of our post-traditional college populations. Within those colleges, there are a series of bachelor's and master's degree programs that can be completed entirely online, or they can be done in a hybrid fashion, which would include some online courses and some on-campus courses, which are typically offered in the evenings or on the weekends. So here you'll see a little bit more about our Regis mission, which very much coincides with the Jesuit mission. So we seek to provide a values-centered education while strengthening commitment to community service. We nurture the mind in the pursuit of truth with an environment conducive to effective teaching, learning, and personal development. So as I mentioned, this really goes along with our Jesuit mission and really developing our students to give back to the community and striving for personal excellence, but also excellence in their community. Our accreditation, Regis University as a whole is accredited by the Higher Learning Commission. We are a regionally accredited institution, which is typically the accreditation you're looking for when you're seeking out a credible school. So all of the colleges that I have mentioned, all the programs at Regis fall within the Higher Learning Commission accreditation. Our School of Pharmacy is relatively new. That being said, there have been a number of pharmacy schools that have popped up since the Regis School of Pharmacy was founded in 2009. So while we are new, we do hold the highest level of accreditation. We are accredited by the Accreditation Council for Pharmacy Education. So now we're going to move into the career of pharmacy specifically. So what is a pharmacist? I'm sure all of you are aware with the role of a pharmacist. You are all here to learn about our Doctor of Pharmacy program. So I'm assuming most of you have done your research, but just at a high level, a pharmacist is a professional healthcare provider with expertise in the effective and safe use of medication and drug therapy. So in earning your Doctor of Pharmacy degree, you are entering the entry level education path in order to become licensed to practice pharmacy nationwide. So everyone who completes their Doctor of Pharmacy degree successfully is then eligible to sit for the NAPLEX. The NAPLEX is the North American Pharmacist Licensure Examination. This is the exam that must be passed to be licensed to practice pharmacy nationwide. And our pass rate at Regis is above the national average. So we are very much preparing our graduates to be successful in this field. So there are a number of different career paths that one can go down coming out of a Doctor of Pharmacy degree program. So I know the ones that people are typically most familiar with are going to be your community pharmacists. Those are your pharmacists that work in retail stores, such as your local Walgreens, CVS, and all of those chain retail stores. They dispense medications to patients that are also answering questions that patients may have about prescriptions, over-the-counter medications, any other health concerns that they may have. Another small role of theirs is to provide primary care services such as giving flu shots. So this is really very much the stereotypical role of a pharmacist, but it's important to note that all of these 6 career paths you see in front of you are career paths that anyone with a Doctor of Pharmacy degree is eligible to go down. So you can change your career path up to 6 times throughout the entirety of your pharmacy career. Clinical pharmacist is another well-known area. However, I don't believe there's enough education at this time about the sort of emphasis that a clinical pharmacist has on direct patient care. So that is certainly an in-demand profession. In this specific role, your pharmacist is going to spend less time dispensing prescriptions, but instead they're involved in direct patient care. They'll be going on rounds with a healthcare professional team, and in going on rounds, they're going to provide patients with recommendations on medication to be taken. They'll oversee the patient's dosage and the timing and delivery of those medications and explain to them what that drug is going to do to them and how it's going to help manage and cure any sort of disease or medication they may be in the hospital for. So some of the other career paths that a pharmacist may go down include industry, so working in areas such as marketing, research and development. There's also a role in academia where they're doing things more along the lines of research. And that is certainly an opportunity here at Regis. We have research labs here. We have a number of faculty members that specialize in areas of research. So while we're a smaller institution where teaching comes first, research comes second to us. So we're very much always happy to connect you with faculty members that may do research in areas that you're interested in learning more about. Informatics is another area that you may go down, in which pharmacists will be working in hospitals, working with information systems and manipulating data and things of that sort. And then consultative services, in which they're advising healthcare facilities and insurance providers on patient medication use and improving the overall pharmacy services. So at a high level, those are the 6 career paths that a pharmacist can go down. A little bit more about the pharmacy career. We already highlighted the career path that a pharmacist can go down. The median salary of a pharmacist is $121,500. So while the cost of going to pharmacy school can be overwhelming, it's important to take note of the return on your investment in going to return on your investment after coming out of a doctor of pharmacy program. The field of pharmacy has been rated as #1 as the best job in healthcare, and that was by 2015 Forbes. And that takes into account the overall work-life balance you have in a pharmacy compared to other healthcare professions. They've also been voted as the number one most trusted healthcare professional. So now I'm going to play a short video clip that's going to just highlight some items about Regis University, our Doctor of Pharmacy program. We're really going to move into the curriculum here within our School of Pharmacy. So before I go any further, I want to make sure everyone's along with me, following me so far. Are you all able to hear me? Can you see my screen? I just want to make sure I am sharing the appropriate screen. Perfect. Thank you so much, Darwin, for your communication with me. I'm going to go ahead and I'll play this video clip. Hopefully the sound quality is good on your end.
Some people look at a degree and see a goal, an accomplishment, an ending. But others see a challenge, a responsibility to do more, an opportunity not only to improve their own lives, but to transform the world around them. Those are Regis people. As our population gets older by the day, medications are becoming more abundant, more costly, and more widely marketed. In this new healthcare marketplace, the role of the pharmacist is changing and becoming more important than ever. At Regis University, we understand that today's pharmacy grads will be expected to do much more than simply dispense medication. You'll be counted on as a key member of a healthcare team, providing patient counseling and clinical services from immunizations to disease management. Our ACPE accredited pharmacy program will prepare you to pursue a wide variety of career paths. But more importantly, our values-based training will empower you to make a positive impact on every patient you see. Will you be part of the solution? Look outward, inquire within. Apply online at regis.edu/rx and start transforming your world today.
So sorry. I think I had put myself on mute. You should all be able to hear me now. Before we go any further, I had asked if the sound quality to the video was okay. Were you all able to hear it? Okay, great. So moving on to the curriculum, that's really great to hear. I appreciate the feedback. Moving on to the curriculum of our Doctor of Pharmacy program, I want to highlight two areas, and that's our integrated curriculum and our team-based learning environment. We'll talk about that in a few moments. I first want to mention that Regis University was the first pharmacy school in the nation to offer an integrated curriculum and a team-based learning environment together. Since then, a few other schools have caught on to our teaching methods, and they now do that like we do. However, we are only one of a few schools to offer these two together still. So a team-based learning environment is really the opposite of a lecture model. It's the idea that you're working in teams about 5 to 6 students. So here at Regis, you'll be put on a team of 5 to 6 students. They're your teammates for an entire semester. Each semester after that, you get a brand new team. So by the end of your third year at Regis, it is expected that you would have gotten to work with everyone within your cohort, about 60 to 70 students. So what does that look like? At the start of each module, students will be given a packet of reading to do outside of class. That packet of reading acts as the faculty member's lecture notes. You come to class having a general understanding of that packet of reading. You'll then take an individual assessment on what you read, followed by a group assessment. These two assessments are exactly identical to one another. Found that teams do much better on the group assessment as they can utilize each of their individual strengths to perform better. Following those two assessments is the bigger portion of the team-based learning classes, and it is a series of patient cases that each of the teams will be working on with their teammates. So the class as a whole will be given a patient case that they'll work on. They'll work on the same patient case with their teams, figure out what the best answer is to that given situation. The faculty members will be going around to each of the individual groups to kind of guide them along. They act as facilitators. They will then have everyone submit their answer, each team submit their answer at the same time using the tools available to them on the table. And then the faculty members will go around to each of the teams to have a team member stand up, explain to the class why they chose answer A and not answer B. And really the purpose is for this to create more of an open discussion where the teams will go back and forth on why they believe their answer to be correct, and maybe the opposing team's answers to be the incorrect answer. So it's really meant to be a learning experience, and the purpose is for the class as a whole to come to a consensus on what the best 1 to 2 answers are on that given patient case. They will then go through a series of more patient cases throughout the module to really learn, to really actively apply what they're learning in the class. This concept does go hand in hand with an integrated curriculum. The integrated curriculum is the idea that in each module you'll be learning about a disease or a subset of diseases, and in that module you'll be learning about the biological and chemistry processes behind that disease in conjunction with a pharmacotherapy and clinical care for how to best care for and manage those diseases. So while it seems like common sense to do that all at once, there are many pharmacy programs out there that may teach you the sciences up front, and then you'll revisit the disease later on in your program to learn more about the clinical care. So because we do an integrated curriculum, in every single class, we're going to have at least 2 faculty members. One faculty member is going to be an expert on the science side, so they're going to have a PhD in a science of some sort. The other faculty member is going to have their Doctor of Pharmacy degree, so be more kind of expert on the clinical side of things. That's really what that is all about. I'm going to show a video in a few moments that will highlight team-based learning for you, and hopefully will provide you with a better understanding of what that looks like. In addition to our integrated curriculum, team-based learning, and the forward-thinking faculty, we have values-based training. That really coincides directly with our Jesuit mission. So in addition to the experimental learning and clinical rotations our students go through, they are also going to be taking part in a service learning, which is integrated into their curriculum. So they will be volunteering in communities and populations different from their own to really develop those empathetic traits. person to give back to the community. In doing this, they will be focusing on reflection to really strive for excellence. And it's really important that they are developing these empathetic traits and learning how to truly care for the whole person, as that's what you will be doing once you enter the field as a pharmacist. So, for example, in their first year, our pharmacy students are volunteering in elementary schools in Denver at their after-school programs, educating children on health and nutrition. In their second year, they're volunteering with the elderly. In their third year, they have the option to choose a organization, a population they want to focus on, maybe a population they're wanting to learn more about or they're passionate about and want to give back to that certain community. So now I'm going to play another video clip similar to the previous one, but this is going to focus specifically on our team-based learning model. While this will paint a better picture, it's really hard to explain this concept without physically being in a team-based learning classroom. So if any of you are ever in Denver, if you are in Denver, definitely reach out to me about scheduling a visit to campus. I'd be more than happy to set up a time to meet with you in person, but also to have you sit in on a team-based learning class with one of our pharmacy student ambassadors.
At Regis University School of Pharmacy, we did something different. We noticed healthcare was evolving towards a team-based approach, but the world of healthcare education wasn't. So we structured our pharmacy program to address this new approach by using team-based learning and integrated our science and clinical content. Team-based learning, better known as TBL, relies on one key insight to transform the classroom. Every student is different. Some are strong in grasping ideas. Others have great on-the-fly problem-solving skills or can balance theory with application. Team-based learning groups 5 to 6 students together for multiple courses each semester. Classes consist of complex in-class assignments, quizzes, and case studies designed to challenge teams every day. As students work together to solve each challenge, learning becomes an active pursuit. Faculty members are there to facilitate student learning and ensure every student has a complete grasp of the ideas at hand. And as each lesson builds upon the last, student engagement and comprehension soar to new heights. Instead of feeling like you have to compete to be at the top of your class, you'll rely on the collective strength of your team, which will prepare you for the real world. As the semester progresses, students discover that good communicators become better problem solvers, and the group becomes more than a group. They become a high-performing team. After 3 years of learning in a TBL environment, our pharmacy students become better communicators, better problem solvers, and stronger healthcare team members. Described as innovative and groundbreaking, Regis's School of Pharmacy is the only school in the U.S. recognized for its fully integrated TBL curriculum. So if team-based learning sounds like it's right for you, talk to Regis today or visit regis.edu/pharmacy to start your application. Regis University. Look outward. Inquire within.
Okay, hopefully that painted a better picture for you about what team-based learning is all about. That is a little outdated, so I do want to make sure you understand that we are no longer the only school in the nation to offer team-based learning with an integrated curriculum, but there are very few schools out there that are doing that today, and we were the first ones to start that overall concept. I want, in talking about the curriculum, one other important component about our curriculum is the hands-on experience that you're going to be getting in the field while you are working towards your Doctor of Pharmacy degree. So what we refer to as experimental learning. So that begins in the second semester of your first year. You're going to begin the phase of your introductory pharmacy practice experiences, otherwise referred to as IPPEs. So starting in the second semester of your first year, you will be off-site at either a community or a clinical setting for 1 day a week, and you'll be at that setting for an entire semester. That following semester, beginning the first semester of your second year, if you started in a community, you'll then be in a clinical rotation. If you started clinical, you'll be in a community rotation. You'll be once again off-site 1 day a week for an entire semester. And then in the second semester of your second year, you can then choose a more advanced rotation of those two settings. And then in your third year, you're going to do an ambulatory care clinic rotation on one of your semesters. In the other semester, when you are not off-site doing your rotation, you're going to take part in our interprofessional simulation lab. Our interprofessional simulation lab is a lab on campus that is really designed for all of our healthcare professional students. So our nursing students, our pharmacy students, our doctor of physical therapy students, our nurse practitioner students, and our occupational therapy students. In utilizing this space, it's a lab space made up of a number of mock healthcare setting rooms. So there's inpatient care rooms, outpatient care rooms, rooms that mock an actual patient's home, doctor's office rooms. And when you're utilizing the space, you'll be going through a simulation. In an ideal situation, you'll be in that simulation with other healthcare students that aren't necessarily pharmacy students. You'll be utilizing either our high fidelity mannequins that can do many things that most human beings can do. They can speak, they can breathe, they have a pulse, they can blink, they can have a seizure, they can do all sorts of things. Or you would be interacting with our actors who are trained to work in the health professional field, and you're going through a actual situation in which you will be working with your other teammates who may be students in other healthcare fields to figure out how to treat the patient. During this, you're typically being observed by a faculty member. You're also being recorded, so you have the opportunity to look back on what has happened to really provide yourself feedback, but provide your team members feedback as well, to be able to really learn how to interact in each of these situations before you actually encounter them in the real world. So the introductory pharmacy practice experience is what you go through in your first 3 years. That is in conjunction with your team-based learning classes. You also have your the pharmacy skills lab classes, so a lab specifically for our pharmacy students that is not done in the team-based learning environment, but that is more individual, and you'll be in that lab class with half of your cohort. Once you've completed those first 3 years, you then enter your 4th year, which in the 4th year, you enter the phase of your advanced pharmacy practice experience, otherwise known as APPEs. At that point, you've completed all of your traditional coursework, and you will be going through a series of 7 6-week clinical rotations, some of which are in required fields, other of which are elective options. Those can all be done in the state of Colorado. You can also choose to do those outside the state of Colorado as well as internationally. We have connections with about 1,000 preceptors at more than 900 locations. So if you are relocating to Colorado from, let's say, Nebraska, and you eventually want to move back to Nebraska, it's likely that we have those connections there, and you can begin doing some of your rotations there to start building those relationships with our pharmacies and things of that sort. So that does bring us to that brings me to my next slide. I know I already highlighted the connections we have with preceptors nationwide and internationally. So it's really up to the student on where they're being placed, and you can work with the faculty members in getting placed in areas that you really would like to be in. One big area that is becoming more encouraged of graduates of doctor of pharmacy degree programs to go after are pursuing a residency program, and that is if they want to enter a clinical setting. So our residency match rate does exceed the national average. We have historically been at about a 70% match rate. So 70% of our students who apply to get into a residency program, which is a postgraduate training program that can be up to 2 years. Typically, you apply for a 1-year program, then you could reapply to get into another program after that, or you can do a 2-year program. The national average is about a 66%, but 30% of our Regis graduates go on to residency programs. So that's something, if you're interested in going down that pathway, it's something we work really closely with our students in making sure they're successful in getting into a residency program. A few employers that our graduates have hired include Kaiser, Walgreens, Denver Health, Good Samaritan, King Super, Centura Health, among others. Now we're gonna just talking a little bit more about the curriculum, but a little bit more about the logistics of our program. So we are technically a 2+4 either a 2 to 3 plus board program, meaning it takes about 2 to 3 years to complete the prerequisites to then be eligible to start in our 4-year professional doctoral program. When you are applying, you can go ahead and apply without completing prerequisites, as long as those prerequisites will be completed by the time you theoretically start in the program that fall. So you do have, typically you are going to start applying the fall prior to beginning in the program. Should you be accepted, you do need to make sure your prerequisites completed by the end of that summer, so early August before starting that fall. For the first 3 years in the program, you are just going to class during the fall and spring semesters. You do have summers off, and then you enter summers in your 4th year. So following your 3rd year, you then are going to be going into your full-time clinical rotations that begin the summer after your 3rd year. The entire program is a total of 150 credits. Those credits are not exactly divided equally as you're taking more in your 4th year, but they are divided equally among your first 3 years. But in your 4th year, you are going through the summer, so you're completing more credits at that time. Our entire, the number of prerequisites to be eligible for our program is 72 credits of prerequisites. That is a pretty fair mix between all of your social science courses and your actual science and math courses. So when I say social sciences, I mean your English, speech communications, social science courses, religious studies, and things of that sort, and then math and science courses. If you are wanting to know where you stand with any outstanding prerequisites and where you would stand with being ready to start applying, I suggest that you send your unofficial transcripts to myself at mbergerio@regis.edu asking for an unofficial evaluation. I'll then send your transcripts to our evaluation team, and we'll put together an unofficial evaluation breaking down the prerequisites you have outstanding and those that have been completed. We can then work together and determine when would be a realistic start term for you. When you're completing those prerequisites, they must be completed from a regionally accredited institution. That could be at a 4-year or a 2-year institution. You must earn a C- or above. So a little bit more about the pathways in our Doctor of Pharmacy program. So there are a few options to opt into certificate programs, in which a graduate certificate program is made up of 4 courses. 3 of those 4 courses can be completed as electives in the Doctor of Pharmacy program, in which you're only completing 1 additional course. New to our Doctor of Pharmacy program as of this year is a dual degree program in Health Services Administration. So you can opt into the dual degree, in which you are also simultaneously working towards your Master's of Science in Health Services Administration. The advantage to doing it in a dual degree format is you are only completing an additional 5 courses outside of the Doctor of Pharmacy degree. That takes into account electives that you would be doing. This is a great opportunity for those of you who want the leadership management experience in a healthcare realm. So it's going to provide you with that foundational knowledge to be to manage or be the proprietor of a healthcare practice such as a pharmacy. So this is something that you can indicate your interest in when you are applying to our program. You can also decide once you're already enrolled that you would also like to be in the dual degree and work towards your Master's in Health Services Administration. Very similar to the MBA, like a lot of other pharmacy programs have as a dual degree, except in my opinion, this is a little bit more relatable to our pharmacy students as it relates specifically to that management expertise in a healthcare field. Okay, so now we're going to move on to the Regis community and what's available to all of our students, specifically to our pharmacy students. As mentioned previously, all of our faculty members either have a Doctor of Pharmacy degree or a PhD in pharmacy of some sort. Here you'll see 2 of our faculty members, our Dean, Dr. Dean Carter, and our Assistant Dean of Student Affairs, Dr. Brian Hemstreet, both of which have their Doctor of Pharmacy degree. But I would say about half of our faculty members have a PhD in a science of some sort and have that experience in research. So coming into the program, we are a very, we really pride ourselves on the small student to faculty ratio of about 10 to 1. So every student is going to be assigned to a dedicated faculty advisor, they will get that assignment this summer before they begin in the program, and they can begin building that relationship before they come on campus. But you are not restricted to just interacting with your faculty advisor. If you have some sort of interest or pathway you'd like to go down, your faculty advisor can work with you in making that introduction to another faculty member who may be able to act as a mentor to you. Financial aid, we have a dedicated financial aid advisor that works with all of our pharmacy students. So that is someone you can become in contact with as soon as the application process. Once you are accepted, and over the summer, make sure you have everything in order and have all of that funding available to you. We have a Center for Career and Professional Development that really is like our career services. One great advantage to our career services is there's a counselor that acts as a liaison to each of our colleges. So there's a liaison for the College of Health Professionals. That liaison puts on two major career fairs every year. We have a healthcare career fair, and then we have a pharmacy career fair, which did happen today. We have a number of employers who come on campus. Our pharmacy students are encouraged to attend even as a first-year student, where they can start to build those connections with others in the field. We also do interviews on site as well during the pharmacy career day. There are a number of pharmacy student organizations. These are professional organizations, national associations in the field of pharmacy. So it's a really good way for you to get to know people in your program, but also start to get that experience in the field, get some good items to add to your resume as well. Library on campus, fitness center. So our pharmacy program is located on our main campus. So you have all our pharmacy students have access to all of the amenities on campus that our traditional student population has access to. So the Regis way, really, and this really does, I feel, correlate with our team-based learning environment. You really become part of the School of Pharmacy in Regis University the day you are accepted. And I would say a lot of my student ambassadors that I work with would really attribute to this. We have a lot of students coming in from out of state. We're about half and half, and they really we have that close-knit community. Our small class sizes, team-based learning model really allows for you to develop that close relationship with your other classmates, and they really become like family to you. Here we just have a few highlights from a Regis alum as well as a Regis preceptor. So I'll give you a few moments to read through this. All right, so now we'll let you read through another anecdote we have from one of our preceptors. So this is where we're sending our pharmacy students this is where we're sending them to, some of them may do their clinical rotations here. So we really do receive a lot of positive feedback from our preceptors. Our preceptors feel that Regis students are much more prepared to work in a team environment. That's something we would very much attribute to our team-based learning model, as well as your experience in our interprofessional simulation lab, which is something that most pharmacy programs do not have. So you're getting that experience with your pharmacy students on a team, but also with other healthcare students on a team, and learning more about the roles of a nurse practitioner, the role of a physical therapist, the role of a nurse. Want to highlight quickly for you the overall cost. So we know that can be an overwhelming item of going on and continuing your education at the doctoral level. We understand the cost of pharmacy schools is not exactly affordable, but we also want to let you know that there are options there for you to make this a worthwhile investment. So we break down our cost to a per credit hour cost. That is $10.95 per credit hour. That ends up being about $37,000 per year for your first 3 years. It does jump up to $52,000 for your fourth year. That is simply because you're doing more credits in your fourth year. Additional costs that you may want to take into consideration include healthcare insurance. You don't need to purchase that through Regis. It's only required if you don't have your own healthcare insurance. And then you'll be going through a number of compliance items coming into the program. That's something that's required of all pharmacy students, no matter the school. When it comes to the assistance and helping you be able to afford your education at Regis, financial aid is really the primary area to really supplement the cost of tuition. So there are a number of financial aid options available for you, but by completing the FAFSA, you'll be considered for unsubsidized and subsidized loans. And those loans can, if you are eligible for FAFSA, you can really qualify for a good portion of what the cost of tuition is. Additionally, there is grant options. The Colorado Graduate Grant is something Colorado residents are eligible for. If you qualify, you would earn up to $5,000 per year. That is a needs-based grant, and you can reapply each year after that. Additionally, we give out $250,000 in scholarships each year to our incoming class. Those are on a tiered structure, and they are merit-based. So scholarships you are not applying for, but our top applicants are considered for those, and they would be awarded a scholarship with their admission decision. There's also corporate funded scholarships. That's about $4,500 in scholarships awarded to our current pharmacy students. We have awards and scholarships committee made up of faculty members whose role is to go out in the community and find these scholarship opportunities for our current students. So plenty of opportunities. We do offer a number of information sessions throughout the application cycle that highlight the financial aid options available for you. So that session will go through this in a lot more depth. So we're going to finish out this session and highlighting what next steps would look like. So in applying for a Doctor of Pharmacy program, you're going to apply during the school year prior to the start of the program. So right now we are accepting and reviewing applications for those who are ready to begin in the program for fall 2018 admission. Our basic requirements include a recommended minimum 2.5 math science GPA. We do take into consideration what your cumulative GPA is, but we have no recommended minimum or minimum. A minimum 30th percentile PCAT score. So the PCAT is made up of 5 categories. That is the average percentile score. So that is a hard minimum, and all students must have a C- or better in all prerequisite coursework by the time they start. We're also looking at the work experience they have, willingness to work in a team setting, and the excellent oral and written communication skills that are displayed during the interview day, which is the final step of the application process. I'm going to drill a little bit more into the funnel of the application. So the application, as I mentioned, launches the summer prior to that following fall. So the application for fall 2018 admission opened up mid-July, stays open till March 1st. You apply through the PharmCast application system by going to pharmcast.org. It's a centralized application system for pharmacy schools. So the benefit is you are completing one standard application and then selecting each of the individual schools you want to apply to. In the application itself, you're including a personal statement essay. You're submitting your official PCAT scores. Official transcripts are sent directly to PharmCast. You're submitting at least one recommendation. We do review all recommendations that come in, and then an application fee for each school you opt to apply to. So once you go ahead and apply, your application is considered complete once PharmCast receives your submitted application and all official transcripts. You can submit your application without PharmCast receiving your recommendation and PCAT scores, as additional time is built in to receive those 2 items. Once your transcripts are received, your application will go through a verification process, which takes up to anywhere from 1 to 3 weeks. During this process, PharmCast is matching up all of your coursework with your application, calculating your GPA, reading through your personal statement essay, making sure there's no signs of plagiarism. They're making sure everything looks good. Once it is verified, your application is then released to each of the schools you've applied to, and at that time, Regis University's admissions committee would have access to your application. We would begin the initial review of your application. You meet our basic requirements and we want to consider you further for admission. You would then be invited on campus for an interview. The interview is the final step of the admissions process. It's a full day on campus. So it's an opportunity for you to really sell yourself as a candidate, as a future pharmacist student, but also for us to sell us as a school and really make sure that Regis University is the right fit for you. So typically the day begins around 8 a.m. It will go until about 2 or 3 p.m. in the afternoon. You'll come on campus, you'll arrive on campus, check in, we'll provide you breakfast. You'll do a team-based learning demonstration led by one of our faculty members. Current students will take part in this process so you can better understand what it looks like. You'll enter the interview section of the day, which is made up of multiple mini interviews. You'll also do a written exercise similar to what you do on the PCAT. Both those two areas are the areas that you will be assessed on and scored on. You'll get to have lunch on campus. During lunch, you'll get an opportunity to mingle with current students, faculty members. You'll also get to hear from our faculty members and their research experience, clinical experience, or practice experience in the field. You'll get a tour of campus as well as a tour of our labs, including our skills lab and our simulation lab. So that's really what the entire day looks like. You'll come on campus, interview is the final step of the admissions process. You'll then find out your admission decision following the interview day. So that wraps up my session for you all. I'm happy to stay on, answer any questions you may have. Please utilize the chat function and feel free to stay on as long as you need to get your questions answered. I want to thank you all for being here this evening, listening to me. I will be following up with all of you and with just some additional information. But I hope this was beneficial. And once again, thank you. What questions do you all have for me? You're very welcome, Darren. Thank you for being here. Yes, you're welcome, Esther. I'm glad you were able to join last minute. You are very welcome. Adam, great question. And the team-based learning is really hard to explain in a virtual sense where we are now. So you're wanting to know how it would work in a practical sense. Could you expand upon your question? What I would really encourage for you to do, Adam, if you haven't already been on campus and you are local, reach out to me. I'd be happy to set up a time for you to sit in on team-based learning classroom. That's really it's gonna make a lot more sense when you see it in action. And then also, if you are applying this cycle and you are invited to an interview, you'll get to see what it looks like during the interview day as well. But essentially, the idea of team-based learning is you're going through a number of different active learning activities where you're really actively applying your knowledge. Each of those patient cases are designed to really help you for when you're out in the field, but those can also be used to prepare for your midterms and exams as well. And you're really utilizing your teammates to kind of work through those problems. Yes, exactly. That is exactly what it means. So yes, that's exactly what it would look like. You would be working on, they refer to them as patient cases. So you might have a case that you're going to look over and it's going to be like figuring out how to diagnose that patient. And you're going to be working on a disease or a subset of diseases at one time. So each case is going to look at a certain situation involving that specific disease, but really focusing on the medication, the science side, as well as the clinical care side as well. Does that make sense? Yes, that's exactly right, Adam. Yeah, Francis, that's a really great question, and I'm glad you brought that up. Yes, email me for what we can do is we can do an unofficial evaluation as a first step. So email me your transcript. I'll then share your transcripts with our evaluation team. They will put together a document that we refer to as an unofficial evaluation. It will check off all prerequisites that you have met, and it will leave a blank the prerequisites you still have to fulfill. You and I would then talk about options for completing those requirements. Okay, so that's really how that would look like. You can go ahead and email me any specific questions you have about that, but I will explain that process in an email when I follow up with all of you. Jelva, it looks like you just joined, so I don't know if you got confused with the time difference. So if you did miss it, my apologies. We have recorded this session, so I can send it over to you. See, another question came in addition to MMIs, will there be an additional individual interview with a board or one of our faculty members? Darren, to touch upon your question, I can talk a little bit more about the multiple mini interview process. So essentially what that looks like is you're going to go through a series of scenario-based interviews. All of those interviews except for one is going to be scenario-based. So at the start of each interview, you'll go through, you'll have your interview session typically scheduled for about 45 to 50 minutes. You'll be placed into a faculty member's office, and you'll go through a series of one-on-one interviews with either faculty members, community members, or a current student. Each interview will come into the office, give you a piece of laminated paper that is a scenario. You'll have 2 minutes to look through that scenario. In private, the interviewer will then return, and then you'll have a 6-minute back and forth dialogue about that scenario. You'll then repeat that process a number of times. One of those interviews will not be scenario-based, but it will be more of a traditional open discussion, which will last a total of 8 minutes, as you will not need those 2 minutes to look over a scenario. So that will be an opportunity for you to talk about yourself, explain to the interviewer a little bit more about your interest in pharmacy, your interest in Regis. You can ask the interviewer questions, things of that sort. That's typically going to be with an interviewer that is part of our admissions committee. But many of your multiple mini interviews are going to be with faculty members. It's about half faculty, half community members. Are there any other questions? All right, well, thank you everyone for being here this evening. I appreciate you all joining me. I will follow up with each of you. And if you have any further questions, please reach out to me directly. You are very welcome, Francis.